And our MAX project is really around people with chronic pain who come to the emergency department. These are folks that are, the euphemism is frequent flyers. They come frequently, they come often, they come sometimes more than once a day, and when they come in, they have the same story, pretty much. And so we realize that it's a fine line between treating pain and enabling addiction. And so this is what we're facing. This is what we're facing, and all emergency departments across the country are facing this.
These patients who are presenting to the ED wanting to be treated for chronic pain, that's usually not the key reason they're coming to the ED. There's a variety of reasons that they're presenting. And this project helped us understand that, our mentality is they're coming to the ED, treat and release. You're in the moment looking at what the patient is presenting with. It kind of gave us pause, where we took that extra 5 minutes with that patient to ask them, why are you really here?
The ER and the outpatient office in the hospital, we weren't really communicating with each other. And with these MAX patients, it really gave us the opportunity to hone in on certain people with the opioid epidemic going on, and we were able to hone in on the problems and really help.
There was a case where the patient did say, she was feeling lonely. And so he went down and he just played some, I don't know if it was checkers or what, with her. But he did that for her. Social isolation. That's a very difficult thing to deal with.
It was really a new way of thinking. So a patient would present to the ER. The ER physician would recognize that they were, one of the patients in the MAX series, and that would really set off a whole chain reaction. They would call over to the primary care physician's office, let them know that their patient had arrived in the ER. We had, from our end, because it's such close proximity, we were able to send a care navigator over. They were able to meet with the patient and, if possible, take that patient over to the primary care physician that day and really see what the issues were. So it really just started a whole chain reaction that, at the end helped the patient, and then kind of helped them see that going to the ER wasn't always the appropriate way to get their needs met.
I think overall, with education and support from the administrative team, to tell the providers, we have your back, and these are the goals also, they got to explain to them, this is what we're trying to accomplish. So once we did that, we started to see a change in the culture. The prescription patterns began to shift, and everybody was embracing it, and they were excited. Oh, we have a MAX series, and everybody knew their parts, and they knew exactly what they had to do, and they wanted to do it. And then little by little, we saw the confrontations and the arguments and the time-consuming, episodes dwindling. They were just going away, and it became very smooth. And patients understood what was our standard of care for chronic pain, and they were not challenging us anymore. We would, every warm handoff that we did, we celebrated. Every time the care navigator came over and took a patient under their wing, and it was a good thing. We were happy, we were celebrating that.
It was a real team effort. We were all on the same page. We were all working together. So it was great for the patients. It was great for us. It was just a great relationship.
For the providers also to understand that, or to promote that mentality that we're no longer doing the treat and release. We're looking to connect the patients with options, treatments, modalities that are good for them, and they're going to end up in long-term positive outcomes, rather than just give me a shot of the water and I want to walk out the door.
And what was eye-opening for us was that our cohort, we thought it was going to be 30 to 50-year-old males, addicted. And we were extremely surprised when we dissected our data. 64 out of the 64 people, it was 47 women from ages 20 to 60. And we had one patient who was 80 years old. So very surprising. Addiction impacts everybody.
We reduced ER visits by, I believe, 64%. for this population, and we reduced administration of opiates in our ER overall by 84%. So that is pretty dramatic. Now, maybe a year ago, there was a young man came running into the emergency department, screaming that his girlfriend's out in the car and she's not breathing. And my staff, they were like amazing. They rushed out there, and they had a wheelchair, and they were spraying the naloxone up her nose, which is a mist to try and reversal agent. Her lips were as blue as my shirt. She was not breathing, and it didn't appear that she'd been breathing for a while. I ran out there and I watched my staff. They were amazing. They were trying to save this woman. They pulled her out of the car and put her in the wheelchair and rushed her into the hospital, and I was sort of standing there kind of almost bewildered. And then I noticed a movement in the back seat, and there was a small child back there. A small child who's been watching mom die in the front seat. So when we think about how powerful addiction is. We think about the most powerful forces that we know.